I think my experience with the rate responsiveness of bradycardia pacemakers and also more complex devices is that it was a neglected field from cardiologists, including myself actually, where we would put the device in and then they would go to the cardiac physiologist for follow-up, and unless there was a problem, they wouldn't really see us. If there was some problems with breathlessness, then the GP might refer to our clinic and we would do sort of basic testing and reassure the patient that the pacemaker is working properly. However, I was enlightened recently in the last 5 years, by a cardiac physiology colleague of mine who really took on rate responsiveness on a different level. And he invited referrals for patients that were symptomatic during exercise with pacemakers. He exercised them, he had a way of monitoring their rate responsiveness comparable to their expected rate responsiveness, and changed the programming of the device to see if he could affect symptomatic outcome. And he did achieve very significant symptomatic outcomes, to the extent where some patients, it may be placebo, it may be not, but some patients told him that very shortly afterwards they felt so much better. So the closed loop stimulation physiologically makes sense. So when your own sympathetic nervous system innervates your heart, if it detects exercise, it will improve the inotropic response and the chronotropic response of your heart. So people that need a pacemaker won't have an adequate chronotropic response, but they will have an adequate inotropic response. And what that closed-loop stimulation does is it tries to follow the inotropic response as a guide to help guide the rate responsiveness, the chronotropic response that the pacemaker is going to provide. And I think it's a good advance.